Hi, Pam.
Hi, how you doing, Doc?
You're looking pretty good. Tell me a little bit about your
I'm,
situation and how you got here and what we're doing
okay.
in your own words.
In October of 2016, I was diagnosed as stage 4 ovarian cancer. Um, that involved having them install a port so that they could put chemo, etc., in there.
And there's a close up of the line going into your port.
Yep.
Okay.
And it's been amazing, really. It's a really good deal. I highly recommend having a port for miscellaneous reasons. But by the time I got my second chemo, then Dr. Bonnie was starting to inject into my port varying amounts of vitamin C, along with some other good nutrients that was recommended by the University of KU. Integrative medicine is what it is. You got to get that integrative in there. Anyway, so we followed their protocol. So I did get chemo, but 24 hours later, I'm in Dr. Bonnie's office getting vitamin C, washing out, giving the chemo a chance to work for 24 hours, and then washing it all out with vitamin C and the other nutrients that she puts them in. Tell me what the other ones are, Dr. Bonnie, remind me.
So we put a B complex. We put vitamin B12. We put folic acid. We put vitamin B6 and vitamin B3 and magnesium and calcium. Mix that in with the vitamin C in the bag of sterile water and let it drip. First, we started out with 15 grams of vitamin C and then gradually worked up to 30 and 45 and then 50 grams, which is your current maintenance dose with the added vitamin Bs and magnesium and calcium.
And that's exactly what KU Integrative Medicine requires, that you ease yourself up to, but then you get to 50,000 units and that's where you stay. And
50 grams.
50 grams, I'm sorry. And I have never suffered the side effects that the other chemo patients were having. They would, like, I'd talk to somebody and they'd say, well, this isn't my normal chemo day, but I had to go to the hospital and get IVs, had to get fluids, had to get platelets, had to all this other stuff. I never had any of that. And folks, this was stage 4 ovarian cancer. I mean, they were not telling me weeks or months that I had. They were saying they were just going to be cautiously optimistic. Well, they weren't optimistic at all. But I told them that if they wouldn't allow me to have vitamin C infused, then I would just go elsewhere. From the get-go, I mean, and I knew no more about cancer than you know about cancer when I was diagnosed. I knew what the average person did, but let me tell you, I mean, I did a lot of intense research, but I cannot recommend highly enough that you follow the KU integrative system because then you get the vitamin C from the get-go, and it made all the difference. I never suffered the tiredness,
Nausea?
Yeah, none of that. None of that. I mean, I really had no side effects other than the very first week, which I wasn't getting vitamin C yet because I wasn't hooked up with you yet, Doc. But that was the only week I had nausea and stuff like that. So,
Talk briefly, Pam, about your tumor marker tests.
oh, the CA-125 came into existence there was no test for ovarian cancer for a long, long time. Then Gilda Radner got it, and she and her husband, Gene Wilder, were instrumental in getting their fellow actors and everything involved in screaming about the fact that there was no test for ovarian cancer. The result was research came up with a CA-125, And that test is a test of the activity of the cancer tumors in your system. Well, my initial reading when they diagnosed me with the first CA-125 was 1,608. My markers now are ranging from 14 to 18.
And what's the
Now-
reference? What's the reference range of this lab?
0 to 35 is normal. So if you're within that range, they consider you not to have, ovarian cancer. So I guess you would say that I'm definitely in remission. But it came down sometimes very, very quickly from that 1608. It went down to 14 and 1100 and something, etc. So I'm not saying that the chemo wasn't helpful. I'm just saying that I wouldn't do it without vitamin C.
And you've also been treated with major autohemotherapy. Can you talk a little bit about that one?
Major what?
Autohemotherapy with ozone.
Oh, I think you ought to talk about
Well,
that.
that's where we take some blood out, a small quantity of blood out, and make sure it's mixed with a little bit of anticoagulant, and then we add that to a small bag of a little bit of saline, and add ozone, which is a combination of oxygen and ozone generated here in the office from medical grade oxygen. We mix that in the bag and then slowly let it drip back into your system through the line that we drew the blood out of. And then after that, we follow it with a high dose vitamin C drip.
Right, and the thing about that is that all is done through the port. So easy, smart.
Easy peasy. Okay, great. And so how are you feeling energy-wise, or activity-wise?
I am 75 years old, and so I've just had cancer for like 2.25 years, and I wouldn't say I'm quite back to my normal activity, but then I was a pretty high energy person always, and so I'm still higher energy than my friends. So while I may not be back to where I was, who knows where I would have been in 2 years anyway. So I feel like I'm very, very close to where I would be, and I give all the credit to the vitamin C and the ozone treatments.
Great. Okay, I'll just take a little picture of your port and then the line that goes all the way up to the bag hanging here, which is dripping very nicely. Thanks, Pam.
You're welcome.